Good afternoon. I'm here with my team, Candice, Manu, and myself, Selena, and we're here to talk about warfarin and its adverse events. So what is warfarin? Well, it's a drug that belongs to a class of anticoagulants, which simply means medications that prevent the blood from clotting. People often call these drugs blood thinners. It is vital that our bodies can form blood clots to control bleeding. However, many medical conditions and inherited factors can make a person more likely to form abnormal blood clots. Abnormal blood clots are dangerous because they can block the flow of blood to parts of the body like the heart, lungs, or brain. Some conditions that are treated with warfarin on a short-term or long-term basis include irregular heartbeat, heart valve replacement, previous heart attack or stroke, blood clot in a vein, called venous thrombosis or deep vein thrombosis, blood clot in the lung, and certain orthopedic surgeries such as knee or hip replacement, as well as inherited blood clotting disorders.
So how does warfarin affect blood clotting? The normal process occurs when vitamin K, which is produced by the body, helps form blood clotting proteins, which in turn hold the blood cells together to form clots. When warfarin comes in, it reduces the body's ability to make vitamin K, which interferes with protein creation. Lower levels of clotting protein makes the blood cells less likely to clot. Warfarin has 3 serious adverse events, the first of which is listed in the black box warning on the package insert, which is indicated for hemorrhages. So the most common side effect of warfarin is bleeding or hemorrhage. The risk of severe bleeding is small but definite, and this is increased when warfarin is combined with antiplatelet drugs. The next serious adverse event is warfarin necrosis. This is a rare but serious complication resulting from treatment when this occurs more frequently shortly after commencing treatment in patients with a deficiency of protein C. Since warfarin initially decreases protein C levels faster than the coagulation factors, it can increase the blood's tendency to coagulate when treatment is first begun, which leads to massive thrombosis with skin necrosis and gangrene of limbs. Lastly, purple toe syndrome is the condition thought to result from small deposits of cholesterol breaking loose and flowing into the blood vessels in the skin of the feet. This causes a bluish-purple color and may be painful. It is typically thought to affect the big toe, but affects other parts of the feet as well.
So due to these adverse events, in 2007, FDA announced the approval of an updated labeling for the blood-thinning drug Coumadin to explain that people's genetic makeup may influence how they respond to this drug. These labeling updates are based on an analysis of recent studies that found people respond to the drug differently based on whether they have variations of certain genes. For physicians, warfarin is a difficult drug to use because the optimal dose varies and depends on many risk factors such as the patient's diet, age, and other drug interactions. Patients who take a dose larger than they can tolerate are at risk of life-threatening bleeding, and those who receive too low a dose are at risk of an equally dangerous blood clot. The dosage and administration of warfarin must be individualized for each patient according to a particular patient's PT test, which is the prothrombin time test that evaluates the blood's ability to clot properly. In their statement, FDA also mentioned that although genetic testing can currently identify who has these genetic variations, most studies are needed to explore the precise starting dose for these particular patients. And they also mentioned that this is one of their steps in FDA's initiative towards the future of personalized medicine. And with that, we end our presentation. Thank you.